Pennsylvania Governor Josh Shapiro visiting Guthrie Robert Packer Hospital in Sayre today to talk about aspects of his latest budget proposal.
And WENY's Alicia Solorzano was at the press conference today, and she joins us live in studio to talk about Shapiro's plans to expand Pennsylvania's rural healthcare workforce. Alicia?
Nick, Renata, Governor Shapiro's visit to Bradford County this afternoon shed some light on the healthcare worker shortage in the state. His new budget proposal is addressing the need for more essential workers in rural parts of the Keystone State by providing extra support for hospitals and healthcare employees. According to state officials, more than 850,000 Pennsylvanians, out of a state population of 13 million, do not have enough healthcare providers in their communities. Guthrie Robert Packer Hospital in Sayre has taken strides to combat this and provide a better quality of care to all patients. Former patient Kevin Gibbs says the hospital saved his life after a motorcycle accident in 2022.
Without their heroic efforts, I would not be here speaking to you today. We are lucky to have this high level of care in this small community.
On the other hand, some residents feel that rural areas of Pennsylvania are being overlooked when it comes to health care. Now, local and state politicians are following Guthrie's lead to expand the workforce. Governor Josh Shapiro says his proposed budget would allot $10 million to support hospitals and invest in loan forgiveness for rural health care workers.
By 2026, if we do nothing, we are expecting to have 20,000 nursing vacancies across Pennsylvania. In that same year, Pennsylvania is projected to have a shortfall of more than 6,000 mental health and behavioral health care.
The plan is modeled on the substance use disorder loan repayment program at the State Department of Drug and Alcohol Programs. Shapiro says there are 3 steps to addressing shortages in rural communities. First, expanding the loan repayment model to include mental health and behavioral professionals in the state. Second, creating a new repayment program focused on healthcare professionals who take jobs in rural communities. And third, strengthening partnerships between hospitals and nurse education programs that guarantee nursing students jobs once they graduate.
Healthcare staffing shortages in rural areas is not unique to Pennsylvania. We see this all across the country. But I'll tell you something, here in Pennsylvania, we know how to come together and solve problems. And this is the next big problem we need to solve.
Governor Shapiro added that the state's efforts to address workforce challenges also spans across several other industries in the state, including getting more local and state police on the streets and teachers in Pennsylvania. He says mark times that Democratic and Republican leaders came together to make progress, and rural health care is the next challenge.